In the third section of our lecture, now we will talk about the different treatment options available for the subdural empyema and prognosis of subdural empyema after all the treatment options are utilized. So some treatment options are the surgical evacuation of the subdural empyema, and also we can try the empirical antimicrobial therapy, also parenteral antibiotic therapy, and how these drugs, how effective they are, and what's the prognosis of the patient with subdural empyema. So treatment is emergent neurosurgical evacuation. Evacuation is usually performed on emergency basis of the empyema, and this can be done through craniotomy. Otomy is the opening by creating a hole in the cranium, and then the abscess or empyema is drained, or it can be by craniectomy. Ectomy is the removal of the cranium. So both these options can be tried for the evacuation of empyema through burr hole drainage. The empirical antimicrobial therapy that can be tried is a combination of different drugs, including third generation. Cephalosporin is effective, including cefotoxime and ceftriaxone, which are third generation cephalosporins, vancomycin and metronidazole. So these are the combination of different antimicrobial drugs that can be tried for the or used for the subdural empyema. Hospital-acquired subdural empyema or nosocomial type of subdural empyema, patients who acquire this infection when they are in the hospital because they have so many different people around them with different infections. They are immunocompromised, they cannot have strong immunity because they are sick, so they usually get the hospital-acquired infections. So if the patient have hospital-acquired subdural empyema, we should get infections due to Pseudomonas or methicillin-resistant Staphylococcus aureus. So these are the common microorganisms that are associated with hospital-acquired subdural empyema. Coverage is with the carbapenem and vancomycin of hospital-acquired subdural empyema. Parenteral antibiotic therapy that can be used continued for minimum of 3 to 4 weeks after the subdural empyema drainage. So after the abscess is drained, usually the antibiotics, parenteral or injectable antibiotics, are given for 3 to 4 weeks for complete resolution of empyema. In most cases, the drainage of the abscess is important. Then the antibiotics are more effective on that area or on that condition. So drainage associated with the antibiotic or parenteral antibiotic therapy for 3 to 4 weeks. Again, treatment with associated cranial osteomyelitis. If there is subdural empyema and it is associated with cranial osteomyelitis or infection of the cranial bone, then require longer therapy, not just 3 to 4 weeks of therapy, require longer therapy. Specific diagnosis of etiological organism is required by the culture based on gram stain, culture of fluid obtained, enter either burr hole or craniotomy, initial empirical antibiotic coverage modified accordingly. So it's important that if the empyema is associated with cranial osteomyelitis, we need to be very specific about the causative organism, and that can be identified by the gram staining or by the culture on the fluid, and which can be removed by either the burr hole or craniotomy. And then we should decide the antibiotic treatment. Prognosis of the patient with subdural empyema after the different treatment options, which can be the drainage or evacuation by the craniotomy or craniectomy. And then again, if it is associated with osteomyelitis, we need to be very specific about the causative organism. Prognosis is influenced by the level of consciousness. We already mentioned that the presentation of the patient is altered level of consciousness, sometimes even leading to coma. Patient might have seizures, knuckle rigidity. So the prognosis depends on the level of consciousness, whether patient is alert or they are unconscious at time of hospital presentation. So it's very important what's the level of the consciousness of the patient when the patient is hospitalized. Size of empyema, how big is the size of the empyema? Speed with which therapy is instituted or started. If the therapy is initiated early, the prognosis will be good. If the therapy is initiated late, the prognosis will be not so good. Long-term neurologic sequel of the patient with subdural empyema, we have include the seizures, hemiparesis, occur in 50% of the cases. So 50% of the cases, almost half the patient who develop subdural empyema will present with the seizures and hemiparesis, loss of sensation in half of the body. That concludes our treatment and prognosis of subdural empyema. Thank you for watching sqadia.com.